Dr. Randall, the Soul Doctor, author of Soul Doctoring, Heal Yourself, Heal the Planet, shares her 40 years of experience as a cross-cultural practitioner, medical futurist, and expert in 20 different modalities of healing, along with amazing interviews with some of the leading minds in medicine and big thinkers in all walks of life. The stories of our lives are the woven energies of our soul's paths. They feed and ignite the spiritual light that nourishes the universal soul, the one mind, the cosmic consciousness where we all come together. This podcast is going to be a deep dive into the personal stories of people who have made significant contributions to the planet. What formed them? What moved them to become these leaders and innovators that inspire us so? Hi, Tanima.
Hi.
So good to hear your voice again. I miss you.
Same to you. I miss you too. It's been a pleasure to be here.
For my guests, I want to introduce you to Tanima Ferdous. Is that how you say it, Ferdous?
Yeah, you're perfect.
Was born and brought up in Bangladesh. And I'll let her tell you the story of how she came to me, but she was my student at my clinic, Randall Wellness Network in Woodland Hills. She completed her Bachelor of Medicine and Bachelor of Surgery with 1-year internship in one of the most remarkable medical schools in Bangladesh. I think it's called Camellia Medical School.
Yes, Camellia Medical School.
And then she moved to the U.S. in 2016. She had decided before with her husband, to move to the United States for opportunities for him because he was in a very specialized area of quantum physics and they didn't have it in his country. And she also wanted the increased opportunity of technology and so forth in the United States for her area of study. So they made the choice to come here, but they came here. They have a big family. I've seen the pictures, and now they just have each other and 2 beautiful little children. But it's a big step to lose all that and leave your country and come here on that kind of adventure and journey. So you have to be really committed. And I think her story is amazing, and it's really representative of what the foreign medical graduate goes through. So that's why I invited her on the show. She completed her United States medical licensing exam, which is called USMLE Step 1 and Step 2, and her ECFMG certification is in process now. So every time I call her, she's studying very hard. What does that stand for, honey?
The ECFMG?
Mm-hmm.
Okay, it is Educational Commission for Foreign Medical Graduate.
Wow. So how many days are these exams?
Okay, the USMLE Step 1 exam is 8 hours long.
Mm-hmm.
And USMLE Step 2 has 2 parts. Step 2 CK and other one is OET. CK is also the same, 8 hours long, and the OET exam is 4 hours long.
Wow. Well, as I was telling you before we started here, as a little girl, I grew up with a Polish family, and they just came from Poland not too long before, and both of her parents were doctors.
Okay.
And I watched them as a little girl go through these arduous steps to repeat their entire medical training in this country once they were already doctors in their own country. So it's just always been something that's impressed me, and how much you guys go through. So thank you for coming and telling us about your journey. After moving to the U.S., she did some volunteer activities. She is a member of the American Red Cross. She did her clinical rotations in Los Angeles and Texas. She's lived in 4 different states. I think because you had to follow your husband where he went, right?
Yes.
Mm-hmm. Currently, she's in Texas, and she has 2 children. And I wouldn't even make an attempt how to say your husband's name. Could you say it for us?
Yes. His name is Muhammad Iftekhar Hussain.
Mm-hmm. Nice. Who is an engineer.
Yes.
So we've got 2 bright parents. We're going to get some bright kids out of that, probably.
I hope
So he earned his PhD from Virginia Commonwealth University in Virginia, and she's been privileged to be the mom of 2 kids, as I mentioned, and she wants to pursue her career in pediatrics ultimately. So tell me about the application process a little bit, Tanima. You had mentioned to me before that how many schools you applied to and...
Yes, application for residency, right?
Mm-hmm.
Okay. I applied this year for the pediatrics. I applied for almost 40 programs, and this is my first year of application. So almost 40 programs to all over the USA.
And what's the average for in your understanding about for...
In my understanding, the average is more than 50 actually, at least 70, 80 program at least for the international medical graduate.
And up to maybe 1,000, right?
No, 100, like that. I mean, the program.
The number of programs applied to.
Yes, the number of program applies to us more than 100 actually.
Mm-hmm.
Yes, more than 100.
And so, tell me, how do you come here and study as hard as you do?
Yeah.
And have 2 children.
Yes, exactly.
And support yourself while you're trying to get through this examination process so you can just apply to residency. How do you do that?
Yes. Okay. Thanks for your question. So in a nutshell, actually, when I married to my husband, by this time he already is a PhD student in USA. So after my marriage, we both decided that yes, I should come to USA to live together, right? As we are married now, and side by side, I always wanted to be skilled, a complete and a physician, and with a better technology, with better knowledge of medicine. I think it is my opportunity, right? As USA is the land of opportunity, and we all know that medicine is so advanced here, right? So it is my opportunity to know better and to do something better for my life and for my country people also. So I decided to move here, and I moved here. So first I moved in Virginia. So I know that here to pursue medicine is very tough as an international medical graduate, and everybody kept telling me that no, you could not pursue here. You should quit and you should start another career, like doing masters or PhDs, like my husband. And some of my friends, some of my senior friends, some of my friends of friends who moved USA like a few years back, and they also choose a different career, right? Other than they quit their medicine and they started the new career, like in doing masters in any other field. Okay, at first I also thought, should I change? Everyone is saying that here it is too tough, but at the end I decided no, I should not. I should follow my heart, and I should pursue my dream, my lifelong dream, to be a good doctor. And I believe that the system is totally different. might be the books are different, might be the technology is different, might be the patients are different, but medicine is the same all over the world. Medicine is the same, the diseases are the same, right? How to diagnose disease, how to deal with the patient, might be it could be different, ethics could be different, but the pathology is definitely the same. So why not? I definitely should try. I definitely studied, right? I definitely have at least some clinical knowledge, I have some basic knowledge, so I can try. So then I didn't listen to anyone, and I started collecting the information.
Beautiful. So you were following your heart.
Yes, exactly, 100%. There are so many negative people around me, so many negative people around me that no, you should quit, you could not do anything here.
Mm-hmm.
And
that's great, honey.
Thank you. And I started collecting the information, and I came to know that I have to pass few exams like USMLE Step 1, Step 2, CK and OET to be CFMD certified, and after that I can apply for residency. And then I bought some book, and also I brought some book from my country also to study for the USMLE. So okay, then I started studying, and it was quite different. It was quite difficult for me because because the system is different. Actually, the main problem, the system is different. Back in our country, we read different kinds of book. Though the course thing is same, but we follow the different system. So at first, I had to adapt with the new system, with the how to read and how to understand everything differently. And by this time, my husband completed his PhD, and we moved to another state. And I have to adapt myself to the new state, with the new people, the new everything, But I never lose my hope. I kept studying, though there were so many breaks in my study, as it's a long time process to get a job for my husband, and to adapt and to move the state. It's a long term process, but I never give up. So, and yes, and the problem is, by this time I also had desire to be a mom. This is completely my desire, actually. No one pushed me. No one told me that, yes, you need a child. But I have the desire. I don't know it was right or wrong, but I had a desire.
I think it's fantastic.
Most of our friends didn't have their child that time, because sometimes career and motherhood could be conflicting in some way, right? So the one who really pursue their careers, most of our friends didn't have their child. They didn't plan for their child, but I already planned, and I became the mother of my daughter on December 2017. Yes, so that for my motherhood and to raise a child by myself, it took a long to take my first step. It is USMLE Step 1, and at this time I also go back to my country for almost 6 months. For some of my personal reason, I had to go back my country. So with my daughter, and after 6 months, I came to directly Los Angeles, and I took my exam. And fortunately, and by the grace of Almighty, my exam score was not that bad. It was good. And
all right.
It was good. And because score matters a lot here. If we pass the exam, it's not enough. If we pass the exam, only passing score, that means we literally have no chance to get into residency. For international medical graduate, we must get a good score, at least above average score for USMLE Step 1. So that it for most of the international medical graduate, it took time to be prepared for USMLE. Because if I pass with a very minimum score, with just a passing score, it means nothing. It means you are done, you should quit. Right?
Wow.
So it's kind of do or die kind of thing. So that it took time, and I took my first USMLE step 1. After that, by this time I took my USMLE step 1. I have my daughter who is then more than 1.5 years, and I also got pregnant with my second son. And in my first trimester, I took my USMLE step 1. In my first trimester with my second son. Am I understandable?
Wow.
Yes.
You don't stop, do you?
Okay, yeah. I took my USMLE step 1, and I didn't even go to doctor in my first trimester because it is distracting to go for checkup. As I have my deadline for exam. So for the first trimester, I didn't see any doctor in any OBGYN. Because I knew what should I take. I just prenatal and other things. So I didn't even go to the doctor. Okay, first I should complete my step 1, then I can go. There are 6 more months waiting for me. Okay, after that, I did my USMLE step 1, and after my USMLE step 1, when my son was 8 months, I took my USMLE step 2 CK. I mean the first part of step 2. CK, and after giving the CK, then I was looking for clinical observership, clinical externship, and whatever I found. And in the meantime, I did some volunteership. I did some health promoting program and some free volunteership and some volunteership program, something related to health. Okay, so
that's good, because when you apply for your residency, they'll like you better.
Exactly. And by this time I also got my PR. That means now I can work. Now I can work. So, and at the very beginning of the 2021, I was looking for some clinical observership, some opportunities, and I googled. At that time it was COVID, and one day I found you. That's it.
So you were also telling me earlier about the competitive nature of applying for a residency. Can you tell us a little bit about that?
Oh, yeah. Yes, it's very competitive for us, as there are so many foreign medical graduates here from all over the world, first of all. So, now, first of all, there are already so many American medical graduates, right? First of all. Second of all, there are so many international foreign medical graduates like us. Okay, and they all worked hard. They all have good credentials. They all have good clinical knowledge, or I mean some good thing in resume. So it's very competitive. It's not only competition with us, it's also competition with the American medical graduate to take us, to hire us as a resident. Definitely we have something very special, very special to make our resume stand out, right? Other than why program director would choose me besides taking the American medical graduate. So it is very competitive for us. So that we must score very high in USMLE exam. USMLE exam, the American medical graduate also and the Caribbean medical graduate also took the USMLE step 1, but we must score very at least above average to get into residency. And we must build up very good resume, like clinical experience and or research publication, so that it is getting very competitive.
Yes. Well, I know when I was on the admissions committee for medical students for UCLA,
yes,
I always knew that the foreign medical graduates had worked twice as hard to get there. So I took that into consideration when I, looked at their folders or interviewed them.
They must be very lucky. They must be very lucky who get you as a committee member, the selection committee member.
Yes. So, I mean, but I look at everything else and you're those things too. And I know because I worked with you, but you're brilliant and, you always have wonderful questions. How did you find me exactly?
Oh, yeah, it's a very interesting story. Okay, I have always in mind that I would like to work with someone who has real wisdom, who is really very knowledgeable, and who I can learn so many things, not only the medicine, but also how to approach the patient, how to talk to the patient, how to listen to the patient. Not just like okay, just this is your symptom, just go to lab and just doing some lab and just giving some common treatment. No, I was looking for someone that who is a complete physician with everything. So, and what I have said you that time, it was COVID and COVID at its peak. So I know that I was very much unsure that who will take me in this kind of situation, and where I can this kind of doctor which I am looking for. So I started googling. I Google and Google has everything nowadays, and and after finding and after searching, I got your name, and I went to your profile. I went and I took that there, and I see that you have more than 40 years experience, and you are not only practicing the internal medicine and gastroenterology, but also you have been practicing like other approach like holistic medicine and the cross-cultural practice, right? So it definitely attracts me. That means something. Here is something that is definitely different from other, and I could learn not only the some basic things of medicine, but also something which I think which we should know, but most of the time we didn't know. Then I called your office, and I was really very scared, and I was that okay, might be I would be rejected. I'd be rejected, and I'll be rejected, might be, but yeah, but your assistant welcomed me, and very warmly. She told me, "Why not? Yes, you can come." I think she talked to you, and you permitted me, and yeah, this is the story how I found your contact. And one day I went to your office. That day I was very scared that, oh my God, she has so much in her credential, and she is so wise, so knowledgeable. I was very unsure that how could you accept me? Am I a good fit for you? I mean, to be your clinical observer. But yes, you were very positive to me, and instantly my nervousness faded away. And I would say it is very important. It is a very important for the mentor to make her mentee comfortable, and you did exactly this. It did exactly what I think what a mentor should do to make her mentee comfortable.
Great. Yeah. And that's how I taught you how to treat your patients like that too, right?
Yeah. And I was amazed that how you gave very long time to your patient. You listen everything what they said, and you were so much patient. I can remember about one patient that she was very much reluctant to take the calcium or vitamin D, some kind of combination. She was very much reluctant, but you tried to understand her again and again. And I was amazed. Oh my God, how patient you are towards your patient. Yeah.
I think I told you. I said, which is what I believe, is that you listen to everything your patient has to say.
Yes.
And they'll tell you the answer. They'll
Yes.
tell you their
Yeah.
own answer.
He told me.
And every patient comes with their own answer if you listen. If it's not in the words they say, it's the spaces between the words.
Mm-hmm. Yes, he
And
told
it
me.
takes having the knowledge, which you've accumulated a lot of, to come up with the ultimate answer. But they'll tell you, and it'll all come clear to you.
Yes, exactly. You listen them for a long time, and you listen them. They are every word, actually. They're each and every word. I followed actually not only the patient, I followed both of you, the patient and you too.
And you asked, the most pointed, brilliant questions too. So that brought us to a different understanding and way of learning for you as well. And even,
Thank you.
I think even in some clinical examinations, I can't remember what it was, but I remember looking at a person's abdomen. There was something about his abdomen.
Yeah. It's a patient. Yeah, you can go ahead.
I don't remember the details, but.
Mm-hmm. Yeah. Yeah. It is a patient of post-surgical duodenum. She had a surgery of duodenum, I think a few years back. After that, she developed a muscle contraction pain in her abdomen.
Oh, right. Yes.
Abdomen.
She had a spasm psoas.
Exactly.
Yeah.
She came all the way from the Texas to the LA just to see you, just to visit you, because she relied on you so much. And yes, and you showed some stretching exercise, and after that you administered. It was a very good thing to learn that the stretching exercise you have shown to her, one thing, and secondly you injected some electrolytes, the magnesium electrolytes.
Magnesium,
right?
yeah.
Yes. Yes, it was, I think it will be a good thing. It was a good thing for me to learn.
Yeah, it's like magical. It'll relax all spasms in your body.
In book I might read, but in practical life sometimes we forget if we don't practice that thing. And yes, it was good thing for me to know and to learn and to reminding the thing.
Beautiful. Great.
Yes.
Well, we had such a good time together.
Yeah. Yes, but I am very much unfortunate. I would say I'm very much unfortunate that I could not stay long. I could not, because I need to move out of the state.
Yeah.
So I lose the opportunity to be there and to shadow you more. I know that I would definitely learn a lot of important things which I could apply to my clinical life, to others, and even in my personal life also. You counsel the patient very well, not only to their.
Thank you.
Yeah.
But you had it when you needed it, so don't think of yourself as unfortunate, because that gift will always be with you, and you grow from there. And I've always tried to encourage you to know who you are, and you're very bright, and you have a lot of knowledge, and you work very hard.
Thank you.
So there's no question in my mind that you're going to do well, because you don't give up. You have hope, and you keep going for what it is that you truly feel that you should, no matter everybody telling you you shouldn't. So, that's the kind of strength. And, you're a very strong lady.
Thank you. Thanks a lot. It means a lot. I need actually this kind of enthusiasm now. Really, as I'm applying. Yeah, thanks a lot.
So you see, I'm not gone from your life.
Yes. I wish you always be there for me.
I always am.
Thank you.
So how is it though? It must be kind of hard, because I saw those beautiful pictures with you, and your family is quite large, your extended family, or at least the ones in the picture. So, and here you are here. What is your support here?
I could not. Thanks for the nice, insightful question. I could not express how bad I feel, because some of my colleagues, some of our friends who have their family here, who have their father, mother, parents here, who have their extended family here, everyone move here, right? But for me here, me and my husband's only, no one here. And back in my country, I am the youngest one. I have four more siblings, including me. We are 5 siblings. I have a big family, extended family. I have my sister-in-law, my brother-in-law, my nephew, my niece. It's kind of very compact family, and we are very close. We are very joint. We did everything together, and we all are very much emotional. And being the youngest one, I was always been very, I could not express in words. I was very much pampered all the time, and I got all the attention from all of my family members, as I was the youngest one. And I would to be very, but here everything is different. Yes, everything is different. I have to do everything by myself. But I think, but to some extent, it makes me very strong. It makes me very strong. It makes me even more practical. But yeah, everyone needs a support system. Sometimes I sometimes broke too, because for my husband's job, I had to move different state. So whenever we make some friends, we make some good friends, we make some good colleagues, I moved again. So all the time I have to make new people. I have to make connection with the new people. So sometimes I feel that yes, I wish I could have some more support system around me, like someone who will speak me with a very soft voice. Before the exam night, someone will tell me, oh, you already did a lot. Some of this kind of words, yes. I sometimes I miss.
Yes.
Those, yeah.
Well, I'm telling you that right now.
Yeah. Yes, you are telling me right now. Yeah.
And like I'm not kidding. Every time I've called you, you've been studying. And you may have your baby.
Yes.
Be breastfeeding your baby. You're still studying. You're amazing. You're a very strong lady. You're going to make a great doctor, honey. Yeah. You already are, but now you're going to be a great doctor here. You're going to go through all the hoops and the tests and the trials and tribulations. Yeah. And, you're a leader for other foreign medical graduates to look to.
Thank you. Actually, without my husband, I could not do. I could not come. I could not come so far. I mean,
God bless him too.
Mm-hmm. Thank you.
So, what is your ultimate dream? Are you living it?
Okay, so yes, I would like to divide it into the short term and in my long term goal. So, in my short term goal, now I would like to get into a residency program, a very good residency program where I can learn a good academic skill and a good clinical skill. Which I can apply to my patient, just to be very honest, my ultimate goal is to be a very complete, skilled physician. Just not a physician that I will see the patient, I will earn the money. Believe me, not like this. I really wanted to be a skilled physician. Skilled, the word I just like to mention the skill. Physician, and my ultimate and in my long-term goal, I can see myself as a primary care pediatrician, as I know how other parents really want a good primary care pediatrician, because it's very important to be a good PCP for the kid. So this is my ultimate goal, to get into a residency program, to be trained well, to be skilled, and being a primary care pediatrician.
Right.
Mm-hmm.
And I hope you learned, and you sort of implied that you learned compassion and kindness, because that's the part they don't teach you when you came to study with me, because it's so important.
Exactly. It's different.
And that kid feels that from you, and then they're going to be calmer. They're going to accept what you have to say, and
Exactly.
you know.
Exactly.
And I see you ultimately teaching as well.
Oh, really?
Mm-hmm.
Okay, it's good. Yeah, I love teaching also. Yeah.
Great.
And yes, you're right. Compassion is something that no one can teach us, right? The book cannot teach us. The training cannot teach us. That is something that we need to learn. Compassion, being compassionate towards the patient, especially towards the pediatric patient.
Mm-hmm. Great.
Mm-hmm.
Do you have anything else you want to say?
Yes, I am very much privileged now to be here and to share my journey with you, and I'm really grateful to you what you have done for me. Really, from the bottom of my heart, I would always be grateful what you have done.
Well, I'm here for you. You have my number, so if you need me, you just call me, okay?
Yeah, thank you.
All right. I love you, dear.
I love you too.
Best of luck. I know you're going to do great, and we'll talk soon, okay?
Okay.
All right. Thank you. Bye-bye.
Bye.
I'm Dr. Gail Randall, creator and host of Soul Stories. I just want to thank you for listening to my podcast. I recently got a notification from the International Podcast People, and I was astounded that so many countries are listening to my podcast in the category of alternative health. So thank you, and please continue to listen. I especially want to thank Egypt, Croatia, Japan, and Switzerland, also France and Ireland, because my numbers were quite high there. So keep up the good work and check out my Instagram at Dr. Gail Randall, and particularly check out my Instagram TV, where you can hear me talking about alternative medicine subjects and also see me. It's a very good show, and I think you'll like the subjects. It's on 6 p.m. Pacific Standard Time every Friday, but it's recorded there, so you can find it there anytime you look. Okay, thanks again. I love you guys. This is Dr. Gail Randall from Soul Stories, and author of Soul Doctoring, Heal Yourself, Heal the Planet. I want to thank Saltology, our sponsor, at bathsalt.com, which fits perfectly into my medicine bag as it, like me, calls upon the ancient wisdom and modern technology to heal, especially with the stresses and ills of our modern times. The Bokek brand uses organic salts combined with organic essential oils sourced from ancient Egypt to provide a perfect remedy for your bathing ritual and healing from modern stresses. The Relief RX brand is a unique one-of-a-kind healing salt that uses organic CBD, treated with a unique emulsification process to create nanoparticles which easily enter the skin to most effectively heal and relieve aching muscles and joints. Whether from chronic inflammation or just a rough workout, this is the perfect healing bath, especially when you add the organic essential oils of neroli, lavender, eucalyptus, or grapefruit. Your body, mind, and soul will be lifted and soothed like never before. Go now to bathsalt.com. I also want to give special thanks to Larry Antonino and Agora Borealis Recording Studio for music and score, and also to closetotheearth.com for IT and computer assistance. Also supported by Randall Wellness Network, bringing health and wellness to you directly. Medical futurist Dr. Gail Madeleine Randall brings 40-plus years as one of America's most forward-thinking doctors, healers, and emerging authors onto a diverse media platform to empower our paths to health, wellness, increased consciousness, and vitality. Gail Madeleine Randall, MD, has long practiced, taught, and encouraged patients to take control of their healing processes and journeys. Randall Wellness Network provides a 360-degree platform for people to heal themselves, and she most emphasizes regenerative approaches for healing individuals, communities, and the planet as one. For more information, go to drgmrandall.com and Instagram at drgailrandall, and check out the robust Instagram series on Instagram TV, also Facebook, Randall Wellness, and also Dr. Gail Randall.